While the Biden administration won't return to a 2020 lockdown, they say, they are still taking the Omicron variant seriously, according to the White House. The question is, will their tactics help already overwhelmed hospitals? And maybe more importantly, are Americans listening? New data found social media interactions for COVID-19 news at an all-time low. Interactions peaked at the start of the pandemic and decreased once vaccines became available. But when the Delta variant was spreading this summer, interest started to rise again. That's not happening with this variant. Experts say it could be pandemic fatigue and the perception that this variant isn't as dangerous. The pandemic has stretched 21 months now. So how do we get out of what seems like a never-ending struggle? Experts say we move from pandemic to endemic. Tadevika Prikyan looks at what that means and what it'll take.
From the plague in the Middle Ages to doctors fighting infectious disease in the 20th century, deadly viruses have continually shaped human history. Viral outbreaks can take one of three paths. Some outbreaks flare up, but then flame out before they do much harm. In 2003, researchers discovered the SARS virus infecting patients in Asia. Its origin was probably from bats. It was a similar story with MERS beginning in 2012. It passed from camels to humans in the Middle East, but it didn't spread easily between people, so the worst-case scenario was averted. The World Health Organization says a pandemic is a virus that spreads easily and infects people across the world. During the 1918 flu pandemic, soldiers fighting World War I spread the virus globally. By the early 1920s, 50 million had died. Just like today, masks, ventilation, and quarantines saved countless lives. After 3 deadly waves, scientists say what probably ended that pandemic was infected people gaining natural immunity, meaning the virus had few new patients to infect. But this COVID-19 pandemic has stretched on for months. So when will this one end? Last spring, the pace of infection slowed. There were hopes that vaccines would allow socializing, safe family events, and normalcy.
If we do this together, by July the 4th, there's a good chance you, your families and friends will be able to get together in your backyard or in your neighborhood and have a cookout or a barbecue and celebrate Independence Day.
Instead, came the 4th wave of the pandemic and hospitals filled up again. The vaccines have saved millions of lives, but new variants have evolved. Now, in rare cases, some vaccinated people are getting sick, what scientists call breakthrough infections. Scientists say it was naive to hope the vaccine would cause the virus to vanish, bringing a swift end to the pandemic. The true endgame, they say, is for COVID-19 to become endemic. Those are diseases that stay confined, spreading predictably each year. The seasonal flu, for example, kills up to 52,000 Americans each year. It's not a pandemic. We get our flu shots, we stay home from work or school when we're sick, and the disease doesn't dominate our lives. It could be the same for COVID. Scientists say pandemics end one of 3 ways. People will either get vaccinated or infected with the virus and recover, gaining natural immunity. Or many more could die, ending the chain of transmission. With fewer and fewer people to infect, the virus will finally slow its spread. Scientists think outbreaks will flare up sometimes, but we'll learn to live with that risk. To get there, public health experts say we need to accelerate vaccinations and continue other precautions. For Newsy, I'm Tadevika Prikyan.